It's just 3 days until enrollment begins for the Affordable Care Act, or as even the president sometimes calls it, Obamacare. And if you're like most, you have a lot of questions. Peter Gosselin is a senior healthcare analyst for Bloomberg Government. He joins us from our Washington bureau. Peter, good morning.
Good morning.
To begin with, as we mentioned, I think a lot of people are very confused by this. Let's start with the basics. Who is this intended for?
Well, in a real sense, it's for everybody as a fallback in case you lose your employer health insurance coverage. This is where most Americans get their insurance. But more immediately, it's for people who don't have employer coverage or don't have any coverage at all, and especially for low and middle income Americans, say $40,000 to $45,000 a year for an individual, up to $90,000 or $1,000 in annual income for a family.
All right, well, basic question number two, how will it work?
Well, once it's fully up and running, you'll go online, and it'll be a lot like shopping for anything online on Amazon. You'll look at the different health insurance plans that are offered in your area, and you'll pick the one that works best for you and your family, and you'll hit buy. But there's one big difference, which is that health insurance is really expensive and too expensive for many people to afford on their own. And the theory behind the bill is it's good for America if everybody's covered. So when this family hits buy, they'll pay part of the bill, and $1,000 a year. Four-person family, $50,000 a year income. And they buy a plan that covers all the basics, but may not be quite as generous as an employer plan. The price tag is going to be something like $800 a month or $9,000 or $10,000 a year. The family is going to have to pay something like $300 a month or $3,400 a year, but that other $500 a month or $5,900, $6,000 a year, the government will pick up.
You mentioned it would be sort of like shopping on Amazon, but a lot of people don't have access to the internet. A lot of people have never done that before. What then for those people?
Well, the government has set up a whole lot of big call centers, and actually, if you go to healthcare.gov online, you can find the 800 numbers for these call centers, and you call, you begin to give the information, and they'll send you a paper application, or they'll take the information right over the phone. The one thing there will not be is there are not going to be storefronts with Obamacare over the door. The whole idea of this bill is to save money by getting this part of the economy better organized, so we're not going to be building buildings.
Yeah, we're hearing reports of some glitches already in the system, though, Peter. Are there problems? With a change this big, there are always going to be problems. And the people setting this up in the Obama administration know that. So one of the things they've done, for example, is sign a contract with a company that can handle, I think they said, 6 million paper applications. Eventually, the bugs will get worked out, and the thing will go entirely online or mostly online or through call centers. But right now, yeah, there's some serious growing pains. You're going to see some embarrassments.
We are hearing that there are a lot of people that are not enthusiastic about this and may not sign up. So if you don't, what are the penalties?
Well, the law provides for penalties that start very low, $95 per adult, half that for a kid, say a couple $100 next year, and that rise to, well, for my hypothetical family of four, say $2,100 a year in 2016. But let's face facts. Both state and federal governments scrambling to get this system up and running. The IRS has already said, and the IRS is managing most of the carrots and sticks for this system, they're going to go easy on penalties this coming year. I'd be surprised if anybody gets them charged.
All right, Peter Gosselin, thanks so much.